Hello, I'm Dr. Jeff Kingsley. Welcome to another edition of Riding in Cars with Researchers. I have the pleasure of interviewing Dr. Joe Surber today. Dr. Surber here is Chief Medical Officer of IACT Health and has been participating in research in one form or another since residency?
Yeah, since
Before residency?
2000 no. Clinical research, 2003 probably.
Uh-huh. So, Dr. Surber.
Dr. Kingsley.
With your lengthy experience in clinical research, getting lengthier and lengthier every year, what advice would you give to doctors considering participation? Why do you participate? Why do you think others should participate?
Very broad question. Designed that way, I'm sure. Research is something that I think every physician, every provider should participate in, everywhere, in some capacity. And I think it boils down to the reason that we all went into the field, right? Going in so that we make medicine better, we make lives better for our patients. And this, in my estimation, is the best way that we can be involved in this. Research is something that keeps us on the forefront of medicine, keeps our skills sharp, is obviously excellent for patients, it's excellent for practices, and it, again, just makes medicine better.
Let's start with keeping our skills sharp. I think probably the general public doesn't realize that most doctors stop learning after residency. It's unfortunate, but there are a lot of doctors that really don't stay up on the cutting edge in their field, and 20 years after residency training, they're still practicing based upon what they learned 20 years earlier. Very unfortunate. Not true of all doctors, but true of many.
Definitely.
Talk about that. Why does research help you remain a great doctor long after residency training?
You know, it's hard. It is definitely hard. If you're in an office setting and you're seeing 4 or 5 patients an hour throughout, you've got walk-ins, you've got papers to sign, you've got insurance issue, your day is full. And you have a stack of journals that continually piles up next to your desk. And you know, in an ideal world, you block time to sit down and read these and see what the newest, best treatment for diabetes or for congestive heart failure or whatever is. And some docs do. Most docs, unfortunately, get stuck into the rut of a practice. And are they bad doctors? No, absolutely not. But are they able to keep up with everything that is coming out in real time? No, probably not.
Yeah.
With research, cutting edge trials are brought to you, and you are participating in the trial. So if there's a new class of blood pressure medicine, if there's a new diabetes drug, a new monoclonal antibody, not only do you read about it in a journal or potentially read about it in a journal, but you have real world experience with it. So it keeps you at the forefront, cutting edge of your specific specialty.
There's a cardiologist that's been doing research with us for, I don't know, probably coming up on 15 years now. And a while back, many years ago, he was preparing for grand rounds. Grand rounds is when doctors teach other doctors at the hospital. They give a presentation to other doctors. And so here's a cardiologist, and he's going to give grand rounds, and he's going to teach largely non-cardiologists about something interesting in his field. And so he was going to teach on anticoagulation, the cutting edge on anticoagulation. And in preparing his talk, he reached out to us and said, hey, send me over all the protocols that I've been on in the last year or two. And we sent them over to him, and he just didn't really think about it, but he was pleasantly surprised to recognize that all of the cutting edge in the field, not only did he know the information, he did the research.
Which is absolutely awesome.
Right.
Absolutely.
And so research can do amazing things. Another interesting factoid that I tell a lot of people, it's been published in, I think, 2 articles, one in New England Journal, I think the other was Lancet. Could have been British Medical Journal. but demonstrating that facilities that do research have better outcomes even in the areas they didn't do research in. So a hospital that participates in clinical research, let's say it's in cardiology, actually has better outcomes even in their surgical department, because research changes how people think.
Exactly.
A
What you say. It's a
hospital
mindset. It
Yes.
changes mindset, processes, the way things are done. It's
Exactly.
a cultural change.
Yes, it
No
really
question.
is. Really
No
is.
question.
Changes how you view the research, the data, guidelines, best practice. Okay, so what else? You made a bunch of points about why doctors should participate. So we've talked about how it helps them stay on the cutting edge. What about,
Patients?
yeah,
I mean, patients are the most important central part of all of this. Research gives patients an option to participate in a modality that they otherwise may not have access to or would not have access to, right? Before it's approved, patients can't get this whatever drug outside of a research protocol. So you've got somebody who needs XYZ treatment. A lot of times, the only way that they can get it is through a research protocol. The other part to that is being involved is completely cost-free to a patient. Patients don't pay for any of it, and along those same lines, because of insurance requirements, financial restrictions, whatever, the care that somebody actually gets in a research trial is far and above what standard of care provides, right? In terms of labs and x-rays and that sort of thing.
Yep. Yeah, I feel like patients learn more about their own bodies and what's going on with their disease or whatever the case may be. Free care. We don't care if they have insurance. We don't care if they have a Social Security card. I mean, it's irrelevant in research. We care about taking care of a patient instead of a research protocol.
Which, again, going back to why we went into medicine, it's about taking care of the patient.
Yep.
And this is the way we all wish that we could take care of patients in private practice, in the hospital setting, and wherever.
Yeah. When you and I both got involved in research way back when, we both had a foot in both worlds. We were in the normal healthcare system and in research at the same time, and that was eye-opening how much better the care is of a person, the financial care, the health care in research versus normal medicine.
And it's
kind
only
of
gotten
amazing.
worse in private practice and stable in research over the years, and I think it'll continue to go that way.
Okay, so anybody out there who's a doctor considering getting in research, do it. Reach out to us. We're happy to give you some guidance. We're happy to discuss why you should and how you can. It's not as hard as you might think, and yet it is. As long as you've got good guidance and good support, it's very doable, and it's incredibly rewarding for you and your patients. So, thank you for riding along. I look forward to seeing you again in the future. Take care.
Bye-bye.